What's insomnia? And what can you do about it? If you haven't watched before, my name is Dr. Nicole Didyk. I'm an internist and geriatrician, a medical doctor with expertise in looking after older adults. Here on The Wrinkle, I give you information that you can use to age successfully or to look after someone who's aging. Today we're going to talk about insomnia, what it is and what you can do about it. Insomnia is trouble sleeping. Sometimes we classify it according to what part of sleep you're having trouble with. So having trouble falling asleep is called initial insomnia. You may be waking up and not being able to get back to sleep in the middle of the night, or waking up early in the morning. That's called terminal insomnia. It doesn't mean that it's fatal necessarily, but it refers more to the time of your sleep that you're having difficulty with. Insomnia can sometimes be a short-term thing. It could be related to a specific stress that's going on in somebody's life, or it could be related to a medical condition. And when that stressor or a medical condition gets better, the insomnia often gets better as well. But there can also be chronic insomnia. 33% of adults complain of chronic insomnia. But in older adults, insomnia is often not straightforward. In fact, it's almost never straightforward. There are many things that can cause trouble sleeping, things that you can potentially fix before turning to a sleeping pill or some other treatment. How does sleep change as a person ages? There are some changes that are a normal part of aging, and they affect sleep. As people get older, they have a reduced sleep efficiency. So that means that somebody spends more time in bed, but less time sleeping. Does that sound like you? Well, it could be a normal part of aging. The other thing that happens is that people's sleep phase will often advance as they get older. What that means is that people will fall asleep earlier sometimes. So they'll feel more sleepy earlier in the evening and then wake up early in the morning. So it's early to bed, early to rise for many normal older adults. If we look at sleep architecture, so that's basically if we hooked a person up to an EEG or a brainwave study while they're sleeping, we would see that there's less deep sleep, less time spent in that rapid eye movement or REM sleep phase. Sleep tends to be more fragmented with more awakenings. That doesn't necessarily result in a less refreshing sleep, but it's an important difference as people get older. Older people probably need a little bit less sleep than they did when they were younger, especially when they were babies and sleeping about 20 hours a day. Those were lovely times. Just because a person is aging doesn't mean that they should necessarily be having trouble sleeping, but older people are often more likely to have other conditions that could interfere with sleep. So things like dementia or major neurocognitive disorder can definitely interfere with sleep. Older adults might be more likely to be on medications as well, and those can sometimes affect sleep. When an older adult is having trouble sleeping, is it always related to sleep, or could it be something else? Sleep is a complex thing, and oftentimes when people complain of sleep, it's because something else is messing their sleep up. So it's not a primary sleep problem, it's related to some other condition. In older people, those conditions could be numerous. For example, pain is a common cause of trouble sleeping. It could be related to a medication that a person is taking. Maybe it causes excess alertness or some other symptom that makes it hard to sleep. Trouble sleeping is definitely common in those living with dementia or other neurodegenerative conditions. That can affect how the brain gives signals that telling us when it's time to sleep or time to stay asleep. Those can be complex to treat, but a sleeping pill isn't always the answer. Other things that can be related to sleep problems include depression. Sleep problems are quite common in those who are living with depression. Often it's that early morning awakening that can be an issue there. If you have some kind of issue that's making you pass excess urine, like heart failure or diabetes, you might be getting up to pee at night. But, sometimes people wake up and they get up to pee. It's not really their bladder, but it's something else that's creating that situation. What you do during the day matters too. Daytime naps can be sleep killers. I know they're a lot of fun and very relaxing, but if you're sleeping for a few hours every day, it's going to be hard to sleep at night. Things like caffeine, especially when taken later in the day, will interfere with sleep. And alcohol, although many people think of it as a relaxing routine at the end of the day, will interfere with sleep. If you look at the sleep architecture in someone who's had a drink of alcohol, it'll be disturbed. So drinking alcohol won't necessarily help with sleep. Being too active close to bedtime can also interfere with sleeping. So it's best to exercise at least a few hours before you plan to retire. Sleeping pills are medications that usually help with falling asleep. That's right, falling asleep. They don't usually help somebody stay asleep. And they have several problems, especially in older adults. Sleeping pills can increase the risk of falls. Sometimes, even after they've worn off and done their job, there are active metabolites that hang around and can still have effects on the body and on alertness. Sleeping pills can be habit-forming. If you have trouble falling asleep, then a sleeping pill might seem to make sense for you. But if your problem is waking up too early in the morning or waking up in the middle of the night, then a sleeping pill probably won't work. What can be especially problematic is if you take a sleeping pill in the middle of the night. Those side effects might hang around in the morning when you need to be alert to do other activities like driving or just looking after yourself. Sleeping pills can be dangerous. They can increase the risk of falls and can cause mental confusion, and they can interact with other medications as well. A lot of times, sleeping pills work a little bit at the beginning, but then their effects stop working, and so people get on higher doses of sleeping pills. In the end, they sometimes just give side effects without giving the desired effect. Over-the-counter sleeping pills are often things that you might have taken before for other reasons. I've seen people take things like Gravol because it is very sedating, but they're using it to sleep. Some medications like Tylenol PM actually have an antihistamine, something that sometimes goes by the name of Benadryl. If you're taking that just for the sedating effect, then you might get more sedation than you bargained for. Over-the-counter sleeping pills can have side effects that are just as serious as prescriptions. Before reaching for one of those, please talk to your doctor or health provider and find out if there's any other way that you can treat your sleep problems. They can all have potential side effects that include increasing the risk for falls and decreasing cognitive performance. So they could make someone seem like they have a dementia when they don't. So if sleeping pills aren't the answer, what else can help? Well, looking at that checklist of other things that could affect sleep, like pain, depression, medications, caffeine, straightening those things out first could go a long way to helping a person's sleep issue. Sleeping pills have a lot of downsides, but what's the alternative? Well, there is cognitive behavioral therapy for insomnia. Now, I give out a lot of information with tips on how to do cognitive therapy for insomnia, but to really do it right, it probably involves working some type of program, either online or with a therapist. Cognitive behavioral therapy involves looking at your sleep patterns, and it often starts with sleeping less. It involves reinforcing associations with what happens around bedtime. So making a strong association with your nighttime routine and sleep. So things like not watching TV late at night, using your bedroom only for sleeping or for sex, and getting up at the same time every day. That last one is often really difficult for people to follow through on, but it's really important if you have insomnia. CBTI is effective, and it definitely is safer than using sleep medications. I meet so many people who tell me they aren't sleeping, and yet they're on one or more sleeping pills. When I point this out and I try to stop the sleeping pill, it often leads to a very long discussion about why the person does not want to stop that medication. I'll leave some links to resources that you could use if you want to look into CBT for insomnia, or even if you just want to learn more about sleep. If you're having insomnia, then it's probably a good place to start by talking to your healthcare provider about what you're actually experiencing. Some people will keep a bit of a sleep diary, kind of tracking for a while what they're actually doing and how their sleep is affected by that. It's important to be honest about all of the medications and other substances that you're taking, like alcohol and caffeine. Consider cognitive behavioral therapy for insomnia before going to sleeping pills. It can be safer and more effective. Thanks so much for watching today, and thanks for joining me here on The Wrinkle. I hope that you'll come back and see me again, or that you'll also visit my website. I'm also on Facebook and Twitter, and you can follow me there. On every one of my platforms, you can leave a comment, so there's lots of ways to interact with me. I'd love it if you would subscribe to my YouTube channel and maybe even leave a comment telling me what you thought of this video. If you like it, you can give it a thumbs up as well. Thanks again, and I'll see you next time on The Wrinkle.